Good deal. I think everybody's coming that's going to be here today. Let me just start off with a little introduction of myself. My name's Larry. My name's Larry Greenwood. I've been in imaging. This will be my 23rd year. So you can kind of do the math on how far back that was. My certifications, I started initially when I graduated X-ray school. I got my X-ray certification. I also do CAT scan. I also do MRI. So I have three certifications involved with imaging. Okay, so I've seen a lot, heard a lot, and it's been a good field. I recently have I worked over in DeLand, AdventHealth, for the last 23 years. Recently, I've taken a promotion. I've been over at AdventHealth Fish. I took a promotion as an imaging manager over there. So I have a department underneath of myself now. It involves ultrasound, CAT scan, MRI, X-ray, and there's another one too. So there's 5 modalities. So I currently oversee all those modalities. I've been asked to come talk to you guys today about the importance that imaging plays in the detection of certain diseases and cancers for men over 50. Okay. These screening exams play a vital role in detecting potential health issues at an early stage, enabling timely intervention and treatment. The goal to find a disease early is so we can make lifestyle changes and you can be monitored more closely to be effectively treated. There we go. Okay. So within imaging, we do have several modalities that we use to help diagnose certain conditions. Most of these modalities are what they call minimally invasive or non-invasive. Non-invasive exams, essentially you walk in the way you are. They're not breaking any skin. They're not doing any IVs or anything. You walk in like a chest x-ray. You do your chest x-ray. You walk out. They also have what they call minimally invasive procedures. Minimally invasive procedures typically involve the insertion of an IV catheter. That's typically in your CAT scans, your MRIs. And certain tests, you have to do that to be able to get a better diagnosis. Okay. The first one we're going to talk about is ultrasound. Okay. Ultrasound is typically used to look for abnormalities within the body, and they also use the MRI or the ultrasounds to help guide the physicians for the biopsies. So typically you'll go in, if you have like a mass or something, the physician will help use the ultrasound to basically guide the needle where they want it to go. Okay. You also have mammography. Mammography is used for people that have a family history or genetic predisposition to cancer. Typically in the past, it's typically thought as a female-oriented modality. There are small percentages of men that do get breast cancer, which we'll cover here shortly. Number 3 is your CAT scan or CT. CT helps detect various conditions, including cancers. This can also help guide biopsies as well. So typically our 2 main modalities help with the biopsies. They either use ultrasounds or they'll use a CAT scan to help the doctor kind of guide to the mass. The MRI is great for the visualization of soft tissue structures and can be used to assess certain types of problems. You also have the DEXA scan, which is used to detect bone density and assess the risk for osteoporosis and bone loss, which as we get older, that is an issue because if you fall, your bones get a little brittle. You can cause fractures if you have bone loss, that kind of thing. And you also have a chest x-ray, which help identify issues with the heart, lung infections, tumors, and other chronic conditions. Okay, so the first modality that we're going to get a little bit more detail in is the ultrasound. Okay, ultrasound is typically considered non-invasive. Ultrasound uses sound waves to basically get an image of the inside of the body. It's unique in the sense that it does provide real-time images for the providers. Okay, and that's why it's useful for biopsies because as a doctor is inserting a needle into wherever, they get real-time images so they can kind of manipulate that needle real-time as they need it. When you go for an ultrasound, typically what happens, depending on the body part that you are getting scanned, you go in, they'll have you remove your clothing, depending on what body part we're doing, and they'll have you put on a gown, and they will also have you lay down on a table, and they use a transducer, kind of like a wand. They put some gel on it, and they just kind of sweep it over the body part to help get that image that they're looking for. So the first big thing is ultrasound of the abdomen, which is up top here, can help diagnose certain types of diseases on the aorta. The first one is an aortic dissection. It can also see an abdominal aortic aneurysm, AAA, which is over here on the right. The image on the left up here, the image on the left is a normal aorta. The image on the right is what they call an aneurysm. So it's basically just a ballooning, weakening of the wall of the vessel, so it basically expands. So not typically an issue, but if it does get too big, they can rupture, and it's easily found on ultrasound. It's typically a one-time screening, typically for men 65 to 75 with a history of smoking. Okay, so super easy exam, definitely something that if you have a family history of, or you're a smoker, you definitely don't want, you want to be able to get that screening to be able to help diagnose that. The other thing is they do a carotid Doppler of what they call the carotid arteries to help determine if there's restricted blood flow due to blockages that can lead to strokes, pulmonary embolisms, or other conditions. Okay, and that's just another simple one. It's basically you go in, they just take pictures of your neck, they slide it up and down, and they're looking at the vessels going from the bottom up to your head. And if there's any kind of blockages, any kind of stenoses in those areas, they can detect that. Typically, if they do see something abnormal on the ultrasound, they will order a CAT scan later down the road to verify. And sometimes surgical intervention is needed, sometimes not. They can just keep an eye on it, treat it with medication, that kind of thing. The third is the ultrasound of the pelvis, which is used to evaluate the lower abdomen and pelvis, focusing on structures such as the bladder and prostate gland for urinary frequency and retention of blood. And also it can estimate your prostate volume estimation, how big that prostate is. All right, kind of what I was just touching on. So typically in the past, mammography has been more or less a female-centered modality, okay, because breast cancer is obviously very prevalent in females. The American Cancer Society estimates that 1% of breast cancers do occur in males. Okay, that is a very small percentage, but it's easily detected via using mammography. Okay, so typically what that is a mammogram is it's an X-ray of the breast tissue, and basically what they do is they put the breast inside. They have this little paddle. They put the breast tissue on the paddle, and then they basically compress that. Some of the ladies in the room know exactly what I'm talking about. Not very comfortable, and especially for males. So when they push that down, typically the technologist will take that tissue and kind of push it in under the camera, and that allows them to be able to get the imaging that they need to get the best quality of imaging. Typically men with a strong family history or genetic predispositions are at a higher risk of breast cancer. Some of the symptoms to be aware of are lumps, mishap in chest tissue, kind of where the ribs meet if it might not be sitting correctly, non-matching chest tissues, rippling appearance of the skin. If you have nipple pain or discharge for more than 2 weeks, that's definitely a time that you want to reach out to your physician and see if they want to order a mammogram. Okay. CT scan. Okay. CT scan or CAT scan. CT scan is, it uses X-rays to show the structures inside the body. So like an X-ray, you get like a two-dimensional picture, okay? It's like you're reading a page in a book. The problem with the X-rays are you have a lot of overlapping structures inside that picture, okay? So when you get a CAT scan, Basically what it does, what I describe it is, it kind of chops you up in a loaf of bread and it puts you back together again, okay? So you're getting, typically on a CAT scan, you're getting anywhere from, it can be 200 images up to 1,500 images, depending on the type of scan that we're getting. The scan itself, we have a couple types. So CT scan is a little different in the sense that we have some non-invasive screenings that we use. We also have some minimally invasive screenings that we do use for those. So it's a really good modality to be able to see the structures within the human body, okay? So the first one we're going to talk about is our cardiac CTA, or CCTA. So what we do for that is you go in, so this is a little bit more in depth as far as the length of exam. Normally CT scans about 5 to 10 minutes. The scan itself for this particular test is about 5 to 10 minutes, but there's a little bit of a preparation that goes into it before you get there, okay? So the important thing about the CCTA, or the cardiac angiography, is we have to be able to get your heart rates down. So before you come in, typically when your doctor orders this used to be done, they would do the angiograms, they would either go in the groin and they would go up with a catheter, shoot some contrast into the heart vessels, and they would be able to see a stenosis. So instead of going through all that, then you have to stay in the hospital. So instead of going through all that, we can bring you in, we can start an IV, and get your in and out in the hospital within 5, 10, maybe 20 minutes. But the important thing is when you go to the cardiologist, what they'll order a CCTA, typically they want some beta blockers because we have to get that heart rate down to a certain level, because our machines are basically, it's fast enough to where it takes our pictures in between the heartbeats. So we want it when the heart is at relaxation, okay? So what will happen is we'll typically administer beta blockers before you come. It'll bring that heart rate down enough to where when we put you guys on the scanner, the scanner will say, okay, listen, we have a nice low heart rate of 60. So it'll scan basically in between the beats, okay? So it does involve a little bit of preparation prior to coming to the hospital. Typically when you get there, you don't have to change out of anything. You come the way you are. We take you to a room, get your vitals, blood pressures, pulse, all that kind of stuff is taken. We start an IV. If we have to administer any kind of heart-lowering medications, we'll do that. Sometimes that is a little lengthy. Once we get you guys out of there, we'll put you on the table. We do administer IV contrast for this test. I don't know if anybody's ever had that before. It's typically the stuff that makes you feel kind of hot, gives you kind of a warm flush feeling all over. So we'll get you on the table. We'll put some heart leads on you because we do take our pictures based off your heart rate. The nurse will come in, check her vitals again, and then they typically administer a nitroglycerin underneath the tongue to help dilate those vessels, because when we take those pictures in the CAT scan, we want those vessels to be nice and big to where if we see any strictures or occlusions, we can see those coming down, okay? Sometimes we do it without. It all depends on the patient's blood pressure. But then we'll give the contrast. The actual test itself takes about 5-10 minutes. And then we pull the IV and you guys are on your way, okay? And that goes to a special lab that we have down in Orlando, and they do these nice pretty pictures of this nice 3D heart with all the vessels coming around, and it's fantastic. Typically, if we have anything that's positive, if we have a positive finding on a CCTA, the next step is the to the cath lab, okay? So it's a good first step. If you're having any kind of chest pain, your doctor wants to see what's going on in your heart. It's a great way. You're in, you're out. You're on your way, no problems at all. The other screening test we have is what they call a low-dose chest screening, okay? This is considered a non-invasive scan that is used to detect small lesions in the lungs. It is typically ordered on current or former smokers over the age of 50. The important thing is early detection of these lesions can improve survivorship by 63%, okay? So whether you're ex-smoker, current smoker, these are considered non-invasive, super fast test. You go in the way you are, they put you on the table. The scan is about 5 minutes or less, and you are out the door. It'll go to radiologists, and then if they have any abnormal findings, they may follow that up with a regular CAT scan of the chest to be able to get a little closer look to see if that's anything of concern. Okay. The other one we do is what they call a calcium score. So this is a little bit different than our cardiac angiography that we do. The cardiac angiography uses the contrast. The calcium score does not. Okay, so the calcium score is a type of scan. It is totally non-invasive. And basically what it does, it gives you a score. So we just scan the heart section, and when we scan the patient, same thing, we put the leads on the patient. We take our pictures. The scanner takes the pictures based off of the heart rate in between the beats, and it basically scores you is what they call it. So they look at the vessels coming around, so they're looking for your plaques, they're looking for your cholesterol deposits. So off this they can see if you're at a higher risk of maybe heart attack, heart disease, and this is a good kind of first step, and this is super easy, especially since it's non-invasive. This is a great step, and like I said, this is another one. So once they do this, if they do see something of concern, they will go ahead and order a cardiac CT angiography, or they may just go to the cath lab depending on the findings they have. So yes, the more calcium you have in your arteries, the higher the score you're going to get. The lower the calcium deposits, the lower your score is going to be. Okay, MRI. So MRI uses a magnetic field to help create a detailed picture of the soft tissues in the body. Okay, MRI, CAT scan, a lot of those modalities do get confused a lot. MRI is the modality that most people, if you're claustrophobic, you will have problems with. There's unfortunately not a better way to get the images, but to basically put you inside a magnet. It is loud, hearing protection. When you do go for an MRI, it is a little bit different than the CAT scan. It is considered minimally invasive as well. The MRI, when you go in, the biggest things is any kind of metallic implants that you have in your body. So there's a very thorough screening before you even go into the magnet. We need to make sure you don't have any metallic fragments, any metal fragments, any brain surgery. So a lot of that stuff will contraindicate whether you have an MRI. Okay, and when you go to do your test, typically an MRI they'll have you remove pretty much everything. And once again, this is a safety issue because the magnet is always on. And if you do have anything, it can potentially cause burning, it can cause just a host of issues. So it is a very safety-driven modality. The first one we're going to look at is an MRI of your prostate. Okay. This is the second most common cancer diagnosed in males. It can be used to diagnose and determine spread of cancer, infections, and enlarged prostate. So typically the way this goes is you go to your urologist. You may have an enlarged prostate, history of prostate cancer. The urologist will order an MRI of the prostate. These scans typically last, this is one of our longer scans. These scans probably last about an hour. Okay, so it's not a very comfortable exam, and you do have to hold very still while we're doing these tests to be able to get the best pictures, because we are focusing on a very small area in the body. We also give a contrast for this as well, so you will receive an IV typically. The contrast they use is not like the contrast they use in CAT scan, but it does serve the same purpose. It helps kind of differentiate the different structures within that area. So on the prostate, we can look at the prostate, we can look at the bed of the prostate, we can also look at the seminal vesicles that sit up behind the prostate to see if and we look for lymph nodes or anything in that surrounding area. If they're concerned about cancer, we can see if that cancer has spread to any other parts within that pelvic area. We also do brain MRIs. Brain MRIs can help diagnose new neurological conditions based off your symptoms. It is also used to monitor existing conditions such as swelling, bleeding, brain development, tumors, infections, inflammation, damage from an injury, stroke, or other problems with blood vessels. So this test is not near as long as our prostate exam. This one you do go in, they do put like a little helmet over your head for the test. Most of the times, depending on the diagnosis, your physician will typically order this with contrast or without contrast or both. Okay, so it is considered minimally invasive as well. Relatively quick scan. It is a very good scan to be able to, because you do get a great look at the interior structures within the brain. And they have a bunch of different sequences they look at. They call them sequences, to where they can target certain things. So your multiple sclerosis, if you have pituitary tumors, anything kind of in that realm. If they think you've had a stroke, this is a great modality because we can see all the soft tissue. We can see what's going on within that brain, okay? DEXA scan, okay, is another modality. Typically, these are at our outpatient centers. This is considered a non-invasive procedure as well. This measures the calcium and mineral deposits in your bones to determine the risk for fractures. It can help diagnose and monitor progression. DEXA, the spine and hip, is recommended. The forearm can be scanned as an alternative if you've had surgery. And the biggest thing about the DEXA scans is we do these for osteoporosis, okay? Osteoporosis is you're losing that bone density. So the problem with that is if you lose that bone density and you do fall, or if you fall, you could break it. It increases your risk for a broken hip. It can also increase your risk for a broken back, because those vertebrae could compress. And there are some medical treatments that can help contribute to that. But so DEXA scan, super easy. We do those at our outpatient centers. Super easy. You kind of go in the way you are. Once again, you lay on a table. They have this little arm kind of thing that just kind of swoops back and forth, takes its pictures, and they send you on your way. All right, and this is probably one of the most common diagnostic tools that we use to help evaluate and screen what's going on with you. And this is normally the first step before anything. So the chest X-ray is used to evaluate the lungs, heart, and the chest wall. Some of the symptoms that they will order a chest X-ray: shortness of breath, persistent cough, fever, chest pain, or chest injury. And it's great, and they use them for monitoring pneumonia, heart failure, cancer, emphysema, and medical device positioning. This is a super easy one. If you've ever been in a hospital, chances are you have had a chest X-ray. We probably do hundreds of these a day. You walk in, put you up against what they call a chessboard, and they take the picture. It does involve X-rays. Super fast, super short, super sweet, and you do this and you get on your way. And the only thing about these is you are getting your 2D image. So you do have, your structures are kind of overlapped. So you don't get that detail that you would on like an MRI, let's say, or a CAT scan, because you have those overlapping of structures inside. So if they do see anything abnormal on the chest X-ray side of things, they would typically order a CAT scan, MRI, and get a little bit deeper look into that. All right, well, that concludes my presentation, and I would like to open it up for any kind of questions that you guys might have. Yes, sir. Oh, sorry.
The local facility, that's Fish. We're relatively new to this area, so I'm not familiar with all the terms. Is the hospital, is that Fish or whatever the heck it's called?
Fish, Advent Fish, yes, sir.
Advent Fish, okay. All these facilities are at that location, right?
So the only thing that we don't do, so there are some that we do. We have Deltona Health Park. So we do most of the imaging at the hospital. We have AdventHealth Fish and AdventHealth the land, and we also have 2 outpatient centers. So we have Deltona Health Park, which is at the end of Saxon, and we also have Victoria Park Medical, which is over in DeLand. Okay, so the low-dose screenings are done at the outpatient centers, and the calcium scores are done at the outpatient centers, and so are the DEXA scans. All other services we can provide at the hospital.
Subpart to the question. These are great, have access to all this kind of testing, but the problem as a newcomer to this area is getting linked up with a doc. It's like trying to see the Pope. I mean, right. you can't get appointments, period, end of discussion. I'm used to a system on the other part of the state with Sarasota Memorial System where there's a totally integrated approach that if you go to the facility and you establish a contact point, you're able to access physicians, all these different tests that are required. I mean, it's soup to nuts sort of approach to things. Is that capability part of Advent?
I'm going to defer that to my partner Ezra over here.
That is the goal. That's the way that we're going. I know there have been some difficulties in getting there, but it is what we are trying to do at Advent, to try and make sure that it's a one-stop shop. You're not having to jump around from place to place. And also with some upgrades with our medical record systems, it's made it a lot easier for us to be able to communicate from just different doctors' offices and everything like that. So we are going in that direction.
Not there yet. Unfortunately not. But I understand.
I've got a pacemaker 8 years, and I've got some of those symptoms that you mentioned. What does that do for me?
As far as for the MRI, I presume you're asking? Or just in general? So I'll tell you, the MRI would only be of concern if you were having an MRI, okay? All these other modalities that you're having, like if you were to get any of the CAT scan, the X-ray, the ultrasound, pacemaker wouldn't matter either way. So I would highly recommend, though, if you have with your pacemaker, they should have given you a little card when you got that implanted. So I would always have that on you, because God forbid something happened, you go to the hospital, they do need an MRI, they're going to want that information. Yeah. And they won't put you in that magnet without having that information. So that's a good thing just to keep in your wallet. So if it does happen, you have it on you, because if you have a stroke and they want to see if they want to see the progression of the stroke, without that card, you're not going on that magnet.
Since he has that, does it mean that he doesn't get a complete picture like all your other modalities do? I mean, with that, he isn't able to go into a magnetic thing. So are these other things giving him a correct picture?
Yes, ma'am, they can. So ideally, there are certain conditions that your optimal imaging may be an MRI, okay? But with a pacemaker, that might be limited, but there are other modalities that we can do in place. For example, so like if you had a stroke, so the first thing you do when you have a stroke and you come to the hospital, the first thing they do is they do a CAT scan of the brain, okay? So that's going to give a great first-time shot of the brain. Typically, the next step is an MRI, okay? But there are some patients that can't have the MRI because of whatever conditions they have, pacemaker, other implants. But they can do follow-up CAT scans to be able to follow up on that. So there are other modalities that we can take those pictures of to be able to get a good diagnosis and good treatment for.
Well, my doctor had me do a CAT scan of the brain, the neck, and the chest last week.
Okay.
First part of this week.
I'm sorry?
How about stents and MRIs?
Stents are normally pretty good. Like I said, that's another thing too. So typically when you get any kind of implant, okay, whether it's a stent or a hip or you have a brain aneurysm clip, they typically give you some type of card. So the important thing is to have that card on you, because those implants, those are critical. And it's not so much that they're going to get pulled out, but sometimes certain stents, that kind of thing, can cause heating, okay? So that heating can cause burns. So the biggest thing is, as an MR tech, if you come to the hospital with any kind of implant, whatever, they need to make sure that the MR tech needs to make sure that the implant, number one, that you have is going to be safe for the duration that you're going to be in the magnet, okay? And it's not necessarily just a matter of, you just being able to go in the magnet or not. Certain implants, the manufacturer put certain conditions on, okay? So for example, so you could have a stent in your leg, okay? And one of the conditions is you can only be scanned for 15 minutes, and then you have to be pulled out, and then you have to have a cool down period of 90 minutes, okay? So it's not just a matter of whether it's just MRI safe, but it's a matter of, can we meet those conditions to be able to scan you appropriately? Does that make sense?
Thank you.
Yes, sir. Okay. Any other questions? Yes, ma'am.
I'm coming back. Hold on. I've had a hip replacement, but I have no card saying anything about it.
Prostheses are normally pretty good. Yeah, hips, knees, that kind of stuff. That's all surgical still. That's not magnetic. That won't cause a problem at all.
Okay.
Any other questions? Well, thank you guys for having me today. I really enjoyed it. I will be back over here against the jukebox. If you guys have any questions y'all want to ask me privately, I will be more than happy to answer those. Thank you guys. Appreciate it.